Patients are not going to pay us because they don't pay us. But as far as we're concerned, they're the boss. Our job is to make that patient get with the confidence and the information to make the right decision for their best interest. 3 million patients that we've actually helped navigate at this. We have about 25 verticals, from female pelvic floor to early stage cancer to preventative cancer screening to cardiac. We do a lot of cardiac work. So
thanks for hopping on today's podcast, Bob. Pleasure to have you on today's episode. First, can you tell us a little bit about yourself and your role at A3 Bar? What was your founder-led origin story, and what pulled you into solving this problem of patient activation?
Yeah, certainly. It's been a long ride. Myself and my partner, Surim, who's in the business still with me, we've owned 6 or 7 different healthcare businesses over the last 20 or 25 years. And we've been between the software side and then also the provider side, where we've actually taken care of patients. The latest one, which is we've always been focused on direct-to-patient modeling, whether it was wound care or ADD or prediabetes, which we've been involved in. The biggest company that we were involved in the early 2000s up to 2010, 2011 was fibromyalgia and fatigue centers. And in that model, we were taking care of patients who were pretty much disaffected by the healthcare system. Rheumatologists really didn't like to take care of them. General practitioners didn't like to take care of them because nobody knew really how to help them. And so we built a model that was sort of a best practice model with integrated medicine docs around the country. We ended up growing it to about 30 locations. But the one thing that was unique about it was to be able to take care of those patients, we had to have a model that was 100% cash or concierge. The patients were super complex. You needed an hour appointment at a minimum to take care of somebody, and you had to see them 3 to 4 times a year. So it was not what would fit in the traditional medical system. You couldn't do it in an 8-minute visit. You had to really spend a lot of time, and it was very complex to understand the physiology with these patients. So we built a model that was about $6,000 a year on a concierge cost. We trained the doctors to do very intensive, very outcome-orientated medicine to help people with chronic fatigue and fibromyalgia. We had a business that was we had an outcome rating of about 87% of our patients have substantial improvement in their lives. So it worked. So the trick with it was always about how do we maintain balance. We always had to have, because the physicians were on our payroll, we always had to have enough patient flow to come through. So we had to be very diligent and very focused on how do we find the right patient who needs our services, who will be compliant with the services, because I can't help somebody if they're not going to be active in their own healthcare, who has the ability to pay and who has the ability to stay focused for a year, because our programs were 1 year at a time, multiple visits over 1 year. So we started building a system, and the system was all about identifying people who had a thought bubble in their head that said, hey, I have this problem, I need help, all the way to getting them to the point where they would actually engage and subscribe to the business. And we had an entire model that we built it on basically a bunch of whiteboards and some spreadsheets, and how we followed people through with a call center. It was very rudimentary, quite frankly. But when you have 30 locations to fill and we did about 17,000 patients over 10 years, we got pretty good at it. We got pretty good at identifying how to message patients, the right patients. We got pretty good at identifying the patients who would actually be committed to the process and would actually follow through. We learned how to ask patients the right questions. We learned how the behavior of patients who would actually not be tire kickers, but actually be people who you can help because they would follow through on their commitment in the process. We can only give you the things you need to do. We can only give you the supplements. We can only give you the treatments that you need. You have to take them when you go home. And so to find those patients that you can actually help, we learned the psychology between what do they act like, what do they do, how do they stay committed, what kind of reinforcement do they need. And we learned that whole process out of trial and error, but out of necessity, right? So when we sold that business in 2011, 2012, we got contacted by a couple companies. Medtronic and Myriad Genetics were the first two that contacted us. And I think there were 2 key things happening in the healthcare at that time. Doctors were being purchased, their practices were being purchased. So one day somebody would be in one hospital system and they would be purchased into another hospital system. And what did that mean for manufacturers? Well, one day they were a Medtronic pacemaker doctor, and the next day they were in the system that only allowed St. Jude pacemakers. So all of a sudden the manufacturers were losing control of their business, And the other part of the equation was that was happening on the business side. And the other part of the equation was when I first started Fibro and Fatigue, we were doing postcards to attract patients. And then we got into digital heavy. Well, but by the time 2011, 12, 13, 14 came around, patients were bringing in 100 pages of Dr. Google. And it was all kind of uncurated information. And they'd show up at the front desk and they'd have massive amounts of information. And then a doctor had 8 minutes to take care of them. And the whole day would get messed up because the patient couldn't get through. You needed 2 hours to get through what they would bring in. Half of it was just nonsense, and some of it was real, some of it wasn't. So the doctors were getting super frustrated because they couldn't really help anybody. And so medical manufacturers, diagnostics, we do a lot of diagnostic companies, we do a lot of medical equipment manufacturers. They were just frustrated because the doctors were getting worn out. They didn't want to do procedures anymore. And they were also losing the doctors to competitors every other week. So they said, if we don't learn how to help the patient directly, that we're going to lose our control of our business. And I said, well, look, we learned how to do it at scale in my previous business. I said, I can do this, but we're going to have to build a software platform that takes a patient from the time they think about something to the time they actually engage the physician. And they have to be properly prepared and vetted through the whole process. But I'm going to have to build software. And I was just incredibly lucky because the Medtronic and Myriad Genetics, Alec Ford at Myriad Genetics, and we had a really good thought leader inside of Medtronic. And Jeff Murtha, who's now the CEO, was actually very helpful to us. They gave us the willingness. They gave us a small amount of funding and allowed us to experiment. And by experimenting, we perfected the model and we built a software platform from an end-to-end system, which turned out to be the sort of 83 bar process map that we do now, that we run the entire process with. So that's kind of how it came to be. It was formed out of necessity and some very good clients that started with us and helped us basically build the prototype and worked with us. It was a great relationship.
That's a fascinating story of how you went from helping these 200 practices to then starting to work with Medtronic, Myriad Genetics. And I want to talk a little bit about those first few clients that believed in what you were building. Tell us a little bit more about those initial clients and how you found, product market fit with them, basically, because I assume they're the ones that started to use the software, right?
Right. I think what we did, and I'd suggest this to anybody, and as I've sort of helped some smaller startups and some younger CEOs, I think the first thing you have to do is raise enough money or try to raise enough money so that your first clients, you could forget about trying to monetize them or try to forget about making margin on them. What you want to do is you want to have somebody on the other side that will work with you and basically try to figure out what works, what doesn't work, give me the feedback, do whatever you can to make them successful and experiment as much as you can, because that's the opportunity that is incredibly hard to get, right? Because once you start charging a price, especially a premium price for a premium service, the expectation levels are very high on both sides. And you're never going to be able to experiment the way you can in the beginning when you have those first loyal clients start to join in and lean in. So I would think of it as, don't think of them as clients, think of them as your biz dev department as partners. You want to really find some partner clients in the beginning to start with. And then you got to work really closely with them. And then don't forget who your partners are that made you, right?
Yeah.
We still have relationships with both companies. We're still very strong relationship with Medtronic on a national scale and an international scale. And, we're invested in their business like they're invested in ours. You have to remember who got you to the dance, and they certainly were the people who helped you get to the dance. They become your baseline clients to your logos that people refer to, right?
Spot on.
So
Yeah.
The number one thing is you got to find partners. They can't be a vendor relationship. It's got to be a partner relationship.
Yeah, spot on. I think any emerging company would relate to that, and certainly good advice on treating, your initial clients as business partners and ones that will work with you and, not trying to monetize them from the get-go. So
right, exactly.
Yeah.
The experience you're going to get is worth 50 times any amount of money you're going to get out of them. The money's not worth it at that point. Just isn't.
Yeah. All right. I want to talk a little bit now about the current patient journey and stuff. You got these initial clients through the door. Can you share a moment or story that really captures, where that patient journey breaks down and why 83 Bar set out to change that for its initial clients?
The healthcare industry in general has a problem, and it's not specific to just healthcare. It's kind of all industries. I call it being inside the Coke bottle, right? You make your own product. You see everything from the lens inside of your own business. When I see people do brochures and stuff like that, they do patient communications. It's all features and benefits. the prospective patient really can care less about your features and benefits. They just want to know, is it going to solve my problem? Is it going to help me? And what do I got to do to get it? And they really can care less about all of that stuff you normally do in a marketing model. So I think that disconnect happens all the time.
Yeah.
And so as you start to do this, we looked at, and being in the direct to consumer model and being on the other side as being the care provider, what we really looked at and said, okay, when somebody gets a thought in their head, what do they do? I don't really care what the product or what the service does, but what do they do? Well, okay, first thing they do is they go to Google, right? They type it in and they try to figure it out. And you know what happens now when you go to Google and you have an ache or pain? You're fairly convinced that within 17 seconds you have cancer and you're going to die, because everything leads to cancer or some crazy disease on Google. And the reality of it is that's like 1,000th of 1% of what is real, right?
And now they ask ChatGPT, so.
Yeah, exactly. That becomes the next model, right? So I think you have people that have an enormous amount of uncurated information. They'll go to their friends. They'll try to get a reference point from everybody. They typically have a person in their family, and everybody's got this person in their family who's the nurse, who has the medical background, or the speech therapist, or whoever, the doctor. But everybody has the cousin, the friend, or whoever that they refer to, and they'll also bring that person into the loop. So now this person has a bunch of inputs, and they're trying to figure out what to do. But their information is pretty it's uncurated, right? So they don't know exactly where to enter the healthcare system. They don't really know the questions to ask. They don't really know if what they're being told is true or not. They're getting conflicting information. And so what we thought about is we said, we have to build a pathway so that we could find people who raise their hand. So now they're in the state of, I have an interest. And then you have to be able to collect data off them. And in the case of 83 Bar, we run surveys, and we collect about 50 or 60,000 patient inquiries a month. And then we have about 60 to 70 nurses that are RNs that are on our staff. They're not contractors, but they're on our staff. And what happens is it's kind of like Uber. The patient fills out the form. We ask a lot of questions and say it's for some sort of overactive bladder, right? Which is a big condition we service. And so that patient will fill out, what drugs were they on, all kinds of stuff and they say they need help. Well, one of the things we offer them, and what's a unique opportunity, is we're going to give you an ability. Our nurse is going to call you and going to review the questionnaire. You're never going to meet the nurse. You're not going to really know her, but you're going to be able to talk to her in a private, confidential way, and say her because most of them are female. You're going to be able to talk to them in a private, confidential way and ask anything you want to ask, and we're going to be able to help you, but you're not going to have to say yes or no. So you're not going to have to stand in front of a doctor and say, I want to do this, or I don't want to do this, or you're not going to be in that uncomfortable mode, and you're not going to be face to face with anybody. And I call that that's the time you have that conversation with that person in your family, but we do it at scale for manufacturers, right? We have a nurse. Our average phone call is 15 to 20 minutes. You could ask all the questions you want, and we'll answer all the questions we can. And then what we're going to do is, once we understand that you're qualified and you want to move forward, we're going to do the handoff to the physician office that we're going to end up referring to. And we're going to make sure you get slotted. You're going to get a faster appointment. They know we've done all the work already. You're prepared. They know you have probably the right insurance, or you're qualified for the clinical trial if it's a clinical trial. And you know exactly what you're signing up for. So these type of patients for an office that's being overrun at the front desk are perfect patients. And so they'll give us better slotting, and then we'll hand you off. And then we're going to follow up to make sure that everything went well. And if anything doesn't go well or your appointment got canceled, we're going to reschedule you. So if you think about it, what's the big difference? We just flipped this system on its head. We basically said the patients are not going to pay us because they don't pay us. But as far as we're concerned, they're the boss. We are working for the patient. Our job is to make that patient get with the confidence and the information to make the right decision for their best interest. The end users, our clients, the manufacturers of either diagnostics or pharma or medical devices, have a much more successful transaction. And the healthcare system wins as a whole. Nobody gets waste time. Everybody gets a much better product, and people stay more compliant. Honestly, it's a solution that really needs to be holistic to the industry, because if you think what happens now is people get a little bit of information, then they show up at a doctor's office. The doctor repeats the same thing over and over and over and over and over again. They stop listening because they've been repeating it thousands of times. They don't hear patients anymore. And you don't blame them because they're just worn out. The patient's frustrated. The doctor's frustrated. Nobody gets better. Nobody stays adherent, and the system fails. Yeah. But we repeat that process over and over and over again, which is insane to me.
Yeah, I love that analogy that you're working for the patient, they're the boss, and you said it's almost like Uber. I mean, and patients are consumers of healthcare nowadays.
That's
It's
it.
all at their fingertips, and it's very important that they show up prepared and they get what they need on time. Otherwise there are other options available in the market,
Yeah.
that they can quickly find.
The best patient for everybody, the best for the patient, best patient for the healthcare system is an empowered patient who's educated. Because an educated patient will decrease the amount of time, allow more time for others. A patient will stay more compliant. They won't waste money in the system. The system works just enormously better when somebody's empowered and educated.
Yeah, couldn't agree more. And you wrote a patient activation playbook. Is everything you just described is that the playbook, or can you share what you did with?
I think the healthcare system, when you walk into a doctor's office, although it still drives me crazy because they ask you to fill out the same forms that you filled out online, like it's the worst experience ever,
Yeah,
right?
yeah.
But what we said is we can't fix everything. But what we can fix is we could fix everything from you have a thought idea in your head to the moment you walk in that door. And I could be as prepared as possible. And that was kind of the blue ocean space that we took over because there were a lot of people, a lot of medical systems have gotten better, a little bit better at sort of making that model work from the doorway in. Nobody really was managing because everybody was sort of floating around out in the outside and touching a bunch of different places. So we focused on the patients before they actually got to the transaction point. That was the model. And so we coined the word patient activation because it's really from the patient activation to us is if somebody raises their hand, all you are is a lead. And if I put a lot of people who have an interest into a medical, but they're not prepared, all I do is overwhelm the medical practice and nobody wins, right? So patient activation is the process between raising their hand and actually arriving prepared. That activation is that process of getting them educated, ready to move, and then scheduled is the point that was sort of what we coined as a patient activation cycle in our business. We wrote the book about it, which was we use a system called Lean, which is, we learn, educate, activate, and then navigate. So with that system, we sort of push patients through, we move patients through a continuum. And that continuum, if you stick to it, provides a very consistent, predictable prospective patient coming out the back end. So at the end of the day, I want healthcare to be better in general. I do not like the experience. It's so frustrating after 20 or 30 years of running concierge businesses or doing this type of stuff. It's so frustrating to get into a healthcare practice and they hand you a mimeographed, a copied form that's been copied 1,000 times. And they ask you to fill out this, and they ask the same questions over and over and over again. And no one even looks at them. That experience to me is just I hate it.
Here's the handout that we printed out, and you might not read.
Nobody reads any of this stuff anyhow, right? And so we wrote the book with the idea that, look, I don't care if you copy it. Like you could be our client, we'll do it all for you. But if you want to build it yourself, I'd rather you build it because I think everybody deserves a better outcome. Yeah. We're in the wealthiest country in the wealthiest country in the world. We claim we have the best healthcare system, and I believe we probably have the best technology. But the process of accessing it hasn't improved much in the last 30 or 40 years, I can tell you. Yeah. In fact, if anything, it's gotten worse. So
And it's something that, providers of all sizes are dealing with, right? Like your smaller practices that have 10, 20 providers to your larger health systems. Access is something that's top of mind for all of them, and how do we get better at improving access, right?
And so the number one reason it fails is the hardest job in the entire medical office is the person sitting behind the desk with that window when you walk in, because they're managing Command Central. It's incredibly chaotic. The insurances make it incredibly difficult job. They're the lowest paid person in the office. They cycle out every 6 months. And quite frankly, they're the glue that holds the whole medical system together. And they're the one who usually catches the mistakes because they're the one who's sort of sitting in the middle of all the chaos. But no one makes an investment in them. It's a job that basically people turn over. I would make an argument that those people ought to be 6-figure plus people on the front end. I'd love to see what would happen if you actually changed the way we modeled our payroll schedules in a healthcare delivery model.
Yeah, that's the first interaction any patient has. That's the front door experience, is who they interact with as soon as they walk in. It's instrumental. So I'd love to learn a little bit more about like 83 Bars approach and like the real world impact you guys are making. I know you talked about the playbook and this lean framework that you guys use I presume in your platform. What kind of impact are you seeing so far? Like numbers, patient success stories, or examples of how it's working in the real world? I think I saw a number that you had 2.9 million patient engagements. Talk to us a little bit about that impact.
We're right around 3 million patients that we've actually helped navigate at this point in the last 9.5 or 10 years of the business. And we have about 25 verticals from female pelvic floor to early stage cancer to preventative cancer screening to cardiac. We do a lot of cardiac work. So we work quite the gamut, and we work everywhere from diagnostic testing, screening and testing, all the way to medical devices and implants. We do a lot of implants. And we also do a lot of clinical trials for pharmaceuticals. So if you think about our business, it's about 50% clinical trials, where we're actually helping patients understand if they qualify and then helping them find the right trial. And then the rest of it is 50% is helping them with the commercial, like get some sort of treatment using their insurance or doing some sort of payment system. So I think that's the key. Everybody always asks me about some of the numbers, and we take care of, there's 50, 60,000 patient inquiries a month coming in. We are typically we're on all the social media platforms advertising. So you'll see our ads all over the place on all the social media advertising platforms. And I think the key part with this is, how do we engage the patients? So the average patient will spend between 16 and 20 minutes on with one of our operators, and they'll have 6 to 8 questions. We record all the phone calls so we can actually make sure that we're having good compliance. We can also tell you who's the most compliant patient, right? So we know that a patient who answers the call, like when they fill out a form, our nurses will get back to them usually within 5 minutes of them filling out a form, because they know the call is going to come in. The patient who answers the phone on that first phone call is 4.5 times more likely to show up for the appointment and stay consistent than the person who answers on the fourth call. Wow. So we have all of these statistics that we know about. We know that how long you could schedule patients out. If you schedule patients out more than 14 days, about 35 to 40% drop off. If you schedule them out 72 hours, you'll get about a 5% drop off of people who don't show up for appointments. Wow. So there's a lot of patient activity that you get to expand on. And we get a best practice model. When we're working for clients, we can build a best practice model around, if you want to be super successful, here's how quick you have to be. Here's what you have to do in your system. Here's what you have to tell patients. Here's the systems you have to provide. Here's what patients respond to, because we're collecting data along the whole part. I think 83 Bar represents a unique opportunity because we're the only one who's connected. Once you enter a healthcare system, they follow you and track you. But before you get to the healthcare system, you're asking this person, nobody knows what you're doing. Everybody's all over the place. Yeah. We actually have you as a continuum because you're filling out our form. You're talking to our nurses. You're engaging with our email. We're sending you maps to the location. We know when you're texting us, and we're responding in text messages. We're responding to your phone calls. We're managing you and advocating for you right to the moment of the transaction. So we're kind of the only company that sits out here that actually knows what happens between you raising your hand and actually showing up. And there's a lot of ways patients get lost, a lot of ways.
That's fascinating. And that certainly makes sense to me. And I see the value of tracking across the continuum and keeping patients engaged. And, if this lean framework and the patient activation playbook makes so much sense, what tends to hold back like pharma companies or sites running clinical trials, or on the commercial side, those facilities that offer treatment? Like what tends to hold them back from adopting this?
I think larger systems can do it. But if you think about, like, if you break down our components, right, we have a demand generation engine on the front end that gets a lot of patient inquiries. Then we have a nurse-based call center in the middle who has to be trained, scripted, has to stay legal and compliant and do all that type of stuff. Plus you need the software to be able to manage it all and be able to record keep it. Then you have all the marketing automation, which is the next component, which is basically, hey, I got that patient excited, they're educated, they're ready to go, but their appointment's now 14 days away. I've got to feed them, drip them information to remind them of what we talked about, and I've got to keep them in the moment. So you have to track all that. And then we have a scheduling format that matches with our compliance schedule. So we have to have that software. And then we have to have a follow-up software that allows us to track the patient to know if they actually completed it or not, so we can measure that golden pathway. And then we have to be HIPAA compliant. We have to have all kinds of med mal liability because we're storing records. And then on top of that, we have to have a reporting platform. So if you think about that, how do you set that up as a single individual? Like, how do you set that up as a company? It's a lot of people and it's a lot of software. It cost me like $3 million to build a software platform. So it can be done. There's no question it can be done. We've had some clients who scaled up where they got to be very, very large and they took it in-house. But for the typical client that's $100 billion in revenue or even less, you're building a big cost center and you have to have a lot of expertise. The thing we get to see, and I think this is the thing I would share with everybody, is if you're going to do this yourself, you're going to see your results.
Mm,
What you get when you go to somebody like us is we see 70, 80 companies' results simultaneously, and we get to pull the best practices from all 70 or 80, and you're getting the benefits of all the best practices. Our nurses who are converting, we're looking at our best converting campaigns, and we're figuring out what we're doing right on those, and we're making sure everybody else is trained. Our ads that are performing best for a given client, we're figuring out why those ads are so much better, and then we're taking that and making sure everybody else gets that right. That's what you don't get when you do it yourself.
right.
You're in a pipe, you're in like your own silo, and that's it. You're only going to see your own stuff.
Sounds like you guys bring a lot of these best practice insights from all these companies. You mentioned 70, 80 that you're working with, and that helps them, I imagine, iterate and scale up a lot faster than they would by them doing it themselves, because
83 bar only exists if we make our clients successful. We have every reason in the world to want you to win. We have zero reasons to want you not to be successful, right?
right.
We don't bill, like, our economic model is really tied towards ultimately the end production at some level. So we're not like an agency who runs time and material. We don't bill on time and material for the
Mm.
most part. And so it's for us, we're not billing hours. And so everything with us is how do we make the party win so that we're just a small part of the transaction.
And so for the folks listening, especially those larger systems that you mentioned and thinking, this is what we need to invest into this. How can they engage with you and your team online?
Well, it's 83bar.com. You can come and talk to us. It's just Bob at 83bar.com, the number 8, the number 3 bar.com. And you could reach us. I will tell you the number one thing that we do is we don't take every client. The first thing we will do is we will talk to you there is zero cost. We want to talk to you and we want to understand what your ideal patient looks like, whether it's a clinical trial or it is a commercial opportunity. Once we understand and we meet with you for about 30 minutes, we're going to go back and we're going to test it inside of our model, and we'll go into the marketplace for 2 or 3 days, and we're going to spend about $3,000 to $5,000, and then we're going to come back to you in a week, and we're going to say, green light, we can make this work for you, and here's everything we learned, and we'll be completely transparent, and you'll get even patient names of people who want to have your service. The second thing will be, hey, this will work, but we probably need to change something. That'll be sort of yellow, or we'll just tell you this isn't going to work for us and not going to work for you. We don't have churn. And churn to us is it's cheaper for us to spend $3,000 or $5,000 up front to make sure you're not going to fail and we're not going to fail than it is for us to just take your money and learn on your dime. I've run businesses before as a provider. I've had many agencies take my money to learn my business. We do not do that, and we will never do that. Yeah. So my point is if you have any interest, give us a call, email me. We're more than happy to have that conversation, but know the first part of it is not going to cost you anything. And we're going to make sure that if you're going to invest your money, we have a very, very high likelihood that this will work, and it'll be incremental revenue for you rather than the cost structure.
Yeah, I love that. Yeah, it sounds like you provide some immediate value, like top of the funnel value for them to understand, like, hey, is this going to work out for me? And you guys come back in a week and tell them, hey, we crunched the numbers, we ran it against our playbook and our framework, and this has a high likelihood of working, or hey, it doesn't. This is probably not the right fit for you. So
it's way better to have that conversation up front and spend the money than it is to have that 4-month, 5-month conversation in the middle where, oh God, it's not working. What are we going to do? And right. You said this and you said that. We don't do those conversations. I don't want to have churn. I'd much rather have really long partnerships. So
yeah, I love that. Yeah, that goes right back to what you said at the beginning. Treating your clients as business partners, and yeah, 100%. Well, Bob, it's been a pleasure having you on the podcast today. I can't wait to share all these great insights and nuggets with the rest of the social media community. And thanks for hopping on board today. And it was a pleasure.
You bet. Happy to join. Thank you for the time.
Thanks, Bob.